differently, abled differently.
Welcome back, and you're watching Abled Differently. 11th of October was declared International Day of the Girl Child by the UN General Assembly since 2011. Ever since, this day has been marked with utmost importance given to the girl child. Andy and Africa Youth Trust brought out key players in this sector to discuss ways of protecting girls with disabilities and without disabilities from sexual and gender-based violence. Take a look.
October 11th was declared International Day of the Girl Child by the United Nations General Assembly in 2011. Since then, this day has been marked with utmost importance given to the girl child.
The theme for this year is Our Time is Now, Our Rights is Our Future. We are commemorating the International Day for the Girl, and we took it upon ourselves to do community awareness and sensitization on sexual and gender-based violence, as well as disability inclusion. We want to focus on the well-being of the adolescent girls with disability, to create more awareness on their rights as young girls with disabilities, as far as education is concerned and health care, not forgetting infrastructure.
Andy and Africa Youth Trust AYT brought players in this sector to discuss ways to protect girls with and without disabilities from sexual and gender-based violence.
We have been actively engaging girls in schools and looking into their issues, which we have tabled today to the policymakers, to the public and international players, to look at what these girls really want and what their issues are. It's a holistic movement for men, women, older generation and the youth to ensure that girls are safe and protected from sexual and gender-based violence.
In the recent past, we have seen increase of sexual and gender-based violence in Kenya, and especially in the slum areas.
Data supports that slum setup has high prevalence of GBV. That doesn't mean that any other place has no GBV prevalence, but it is also common in the slum setup that GBV is highly perpetuated, and girls are more survivors than men and boys.
It is because of this that training is conducted in school and public forums to sensitize on these matters.
We go to the schools to create awareness about gender-based violence, about sexual violence. The girls need to understand their private parts, which nobody should touch, nobody should see, nobody should play with them, because the perpetrators, this is not something that just happens all of a sudden. It's something that is planned. They should speak out. If they have been gone through any form of violence, they should not keep quiet. We encourage them that there is somewhere where you can report, even to your parents, to your teachers, somebody you are close to. You should not keep it to yourself. We teach them that it's not right, even not only about sexual violence, even the harmful cultural practices that are happening in our community, like now female genital mutilation. We also have cases of early marriages.
Some of the social deterrents include prosecution and sentencing of perpetrators.
We ensure that the survivor gets justice. Once we pin down these perpetrators in the community, we reduce these cases. In fact, if maybe they can understand that the perpetrator was jailed or prosecuted, it reduces those cases in the community.
Girls with disability are at a greater risk to sexual and gender-based violence. And according to Ryle, a sexual and gender-based violence expert with the Nairobi County, it is important for them to be equipped with this knowledge.
But we've also sensitized people with disability about matters sexual violence. So like any other survivor, they should also get the same services like anybody else. They should not keep quiet. They break the silence and talk about it so that they can get justice. It's not okay for them to be violated.
The International Day of the Girl Child brings fresh perspective on the challenges girls face within our communities, reminding parents and guardians of the weight of parenting. It is important for everyone to be their sister's keeper and help weed out the bad apples within our communities.
We are calling upon the public especially to support our efforts in ensuring that cases that reach the court are they come up as witnesses, because cases go to court, yes, but witness withdrawal is one of the issues that affect our work. So we hope that public can support us in ensuring that whenever a GBV case is witnessed, they are able to come up and speak as witnesses in the court. And also, when they see an abuser, they have a role to play to stop them. They can stand in and say this is wrong. Despite the profiles of these people, it's their responsibility to protect girls within our communities. It's a holistic movement for men, women, older generation and the youth to ensure that girls are safe and protected from sexual and gender-based violence.
As we work towards creating awareness on disability, we as well need to address some of the causes. Apart from genetic causes, accidents and lifestyle changes have contributed greatly.
A lot of these conditions do not have symptoms, do not have signs. So many people are living with a condition that has not been identified, and then they tend to be diagnosed when the condition has progressed, when it is more difficult to manage. In addition, we as NCD Alliance are also advocating to the government in terms of capacity building of healthcare providers to be able to recognize NCDs.
We have so many people who don't get the information, and that's where we are asking the government, it's another ask, can they please, if they are not able to send their personnel, can they involve us, those people who have a technical know-how of creating awareness or advocacy, so that we can go to the deep, deep end of our communities, of our counties, to tell people what is happening. It's so unfortunate that you walk to one end. I'll take like Nyeri. You go to places like we call Gobet or in Russia. You can't, you get somebody has an infection in their breast, but they don't know what it is. It is swollen to a point or even bursting, and they don't know what it is. The only thing they can do is going to a mganga, if they know, or putting a herb. We want the government to do something about creating awareness and advocacy.
Lifestyle changes may lead to non-communicable diseases such as cancer, diabetes, sickle cell, and stroke.
NCDs are the leading cause of death in our country. They account for more than 55% of hospital-related deaths, about 41% of all deaths in the country. But if you look at the budgetary allocation for NCDs, if you compare to what is allocated to communicable diseases, and we're not saying that communicable diseases should be ignored, but we really need to up the game in terms of prevention, management, control, palliative care and rehabilitation for persons living with NCDs and for the entire Kenyan community. How can we emphasize prevention? Because up to about 80% of NCDs can be prevented. We recognize sickle cell disease, we recognize the congenital heart diseases, type 1 diabetes, Down syndrome. There are those specific NCDs which cannot be prevented because they have a genetic origin. But by and large, the majority of diseases can be prevented and can be managed.
It is for this reason that people with non-communicable diseases, NCDs, are calling on both the national and county governments to prioritize budget allocation towards awareness creation.
I'm proud of the survivorship of those people who have worked with me, of those people who have counseled me, of those people who have been with me. Because when I was first diagnosed, it was too tough. The only place you could get good treatment was in Nairobi. I was from the rural area. Coming to Nairobi was difficult. And even others I'm representing had that difficult time. We didn't have chemo in our rural areas. We still don't have the radio in our rural areas, but still we have survived, and that is why I'm very proud of it.
7 hospitals in Kenya now that have the capability for transplant. And two of these are public hospitals, that is Kenyatta National Hospital and Moi Teaching and Referral Hospital. But we have not seen a great turnover from dialysis to transplant, because most of the patients who are on dialysis and have no out-of-pocket expense are afraid to get a transplant, which will require them to spend 40 to 60,000 a month on post-transplant medication. And those who feel that they cannot not afford this then are forced to remain on dialysis. And we would like the government to actually come forward and address this disparity. We, the people living with non-communicable diseases, that is NCDs, in Kenya, call upon the new national and county governments to address our concerns and expectations. The Kenya Kwanza Manifesto contains commitments on health that we need to be implemented as a matter of priority. We welcome the appointment of Susan Wafula as the CS for Health and pledge our full support in the delivery of the highest attainable standard of health for all Kenyans without financial hardships. As the new national and county administrations embark on rolling out their programs, we would like to urge them as follows. Prioritize NCD-specific budgets and allocate adequate resources commensurate with the burden of NCDs as stipulated in the NCD strategic plan. Strengthen policies and legislations to address the rising burden of NCDs. Ensure meaningful involvement of persons living with NCDs in key decision-making processes, including policy, budgeting, and implementation as key to NCD response. Reduce NCD drug stockouts in the country and include in the Kenya Essential Medicines list. Efficient rollout of universal health coverage, or UHC, nationally, prioritizing NCD treatment and care packages in clinics in primary health care as envisioned under UHC, and harmonize NHIF packages and contracts to include all cadres of patients and include life-saving NCD specialized procedures. We commit to play our role and join hands with stakeholders in all levels of government in ensuring that the health programs by the new administrations leaves no one behind.
Let's take a look at the UN Convention on the Rights of Persons with Disabilities.
Article 25 of the UN Convention on the Rights of Persons with Disabilities states that state parties shall, Part B, provide those health services needed by persons with disabilities, specifically because of their disabilities, including early identification and intervention as appropriate, and services designed to minimize and prevent further disabilities, including among children and older persons.
And here is the tip for the day.
I remember once when they introduced the UHC in my county. Yeah, my county was in the pilot, and the only thing I saw was they bought a lot of medicine, a lot of drugs. But why buy those drugs? Do you want people to get sick and come to the hospital? So we need advocacy and creating awareness. They should put some money, some funds in creating awareness and advocacy, not just drugs. We don't want people to get sick. Like me, singemtakia mtu awe mgonjwa, ningetaka aambiwe bele awe ati anajishunga.
As we come to the end of the show, ask yourself what your contribution is towards the betterment of lives of girls, especially for those who have disabilities. Also, what is your state of mind? Are you able to speak out and receive the help that you need? My name is Jen Theory, and until next week, goodbye.
We are here and we are strong. Let's be counted as we move on. Make a difference, change lives as we tell our different stories. disabilities, we are capable, beautiful, we are born to do great things. We're unstoppable, incredible, 'cause we're differently abled, differently.